Also tonight, with new positive cases rising and new information on the Omicron variant, the CDC has issued new guidelines regarding how long people should quarantine after exposure. The change is marking a big shift as we near the 2-year mark of the ongoing pandemic. News 5's Jordan Vandenberg has more tonight.
The new guidance from the CDC cuts in half the amount of time that people need to stay isolated if they're asymptomatic and have been exposed to the coronavirus. That could keep them out of lines at COVID testing centers like these and get them back to work sooner. Hospitals are still treating it, staff are still testing it, and the CDC is still talking about it. COVID-19 will still be with us in 2022, but how it's managed has changed a little bit.
I think it'll benefit all of us emotionally and mentally. We know that this entire pandemic has been so hard on all of us, and especially our vulnerable people, people living alone, and our kids who have been so disrupted.
The CDC now recommends people who test positive but are asymptomatic isolate for 5 days instead of 10. For those that are either unvaccinated or not fully vaccinated and boosted, CDC recommends 5 days of quarantine and 5 days of masking afterward. Those that are fully vaxxed and boosted but do not show symptoms can avoid quarantine entirely. The changes are due in large part to data that shows that people are most contagious in the 2 days before symptoms appear.
Where are we most at risk for people spreading? Clearly the data shows that it's really within those first few days before, and certainly for several days after. That doesn't mean that by day 5, everybody is clear.
The more employees we have, the more people we could probably, we could have a higher turnaround time, of course. But right now, like I said, we're a little bit short-staffed.
Charity Ward, who supervises the COVID testing site in Parma, says the changes in CDC guidance will help employees get back to work sooner and the site running more smoothly.
It's been emotionally and physically rough because you see like the heartache and the anxiety and the nervousness that people,
especially here in Northeast Ohio, we are very stretched, not only from the number of patients who are ill with COVID right now, but also employees who are out as well.
Although the CDC's new guidance is welcome news, Dr. Hoyen stresses people should still practice common sense and caution, especially as New Year's Eve approaches.
We can all be excited about this, but we can't ignore the information that they've given us and take this as a pass to, think that, all bets are off now, because they're still not. And we really still need to protect those vulnerable.
In Parma, Jordan Vandenberg, News 5.